Muy buenos días. Good morning. Bon dia, comunidad. Thank you so much for being here today in this Friday, closing the week, where we are here together in our daily webinar. This is the Hispanic Response and Recovery Plan, and we're here every day to make sure that we bring incredible speakers so that we Hispanic leaders and the community can have the opportunity to be enlightened, to be inspired, and to be informed about what is the situation with COVID, what can we learn so we can take better decisions. This is a forum for Hispanic leaders to be informed and to be coordinated. And it is an absolute pleasure to be able to welcome today an incredible leader of communications, my former boss, and now the Undersecretary General of Communications of the United Nations, Melissa Fleming. Melissa, thank you so very much for being here with us today.
Claudia, it's so good to see you, and thank you for having me, and it's great to be with all of you. So yeah, Claudia, I'm going to let you lead this discussion and ask away.
And Melissa, thank you so much. I mean, like, one of the things that we understand is that COVID has affected us all. But what I want to share with you is that for the Hispanic community, Latinos in America, 60 million people, 18% of the population, 12% of the GDP, super young, super powerful, super growth, and nevertheless, disproportionately affected by COVID. At the health level, we've heard that, like you probably saw in the news, 34% of the mortality of New York City comes from Hispanics. That makes us 29% in the city, and national average, we over-index in our mortality rate. We're 18% of the population, 34% of the mortality rate. We're affected by health. More than 20% of Hispanics don't have a medical insurance. So we know that we're disproportionately affected at the health level, at the economic level. A lot of our small businesses and entrepreneurs and independent workers have lost their jobs, their incomes, their salaries. So we know how an incredible impact is having on us at the economic level, but also we're disproportionately exposed. 19 million Hispanics are in essential functions. So the reason why we created this, Melissa, is to put a framework for all of us to create collective action, to coordinate efforts, to put a framework to mitigate the impact of COVID in our community. And part of that effort has meant to raise awareness of the issue, to raise awareness of the solidarity that we have to have with one for each other, and to make sure that we collectively create a plan that later will be a recovery for all of us. So we take this we take this quite seriously, that we're disproportionately affected, but also know how important it is to be coordinated. So it is my absolute pleasure, Melissa, to welcome you, to give us some guidance about how are you at the global level thinking about communications for the world on COVID. I know that you have shifted, you shifted your plans, you have pivoted the United Nations, and we're here to follow your guidance. You have at the Hispanic leadership, the most incredible Hispanic creatives that are going to be taking note and following guidance so that we can align with the global plan that you have put together. So thank you so much for being with us. Please guide us on what your thinking is. And I think that you have a couple of slides to present, if I'm not wrong.
Thank you very much, Claudia, and it's really, really good to see you. And against the backdrop of what you mentioned, I have been following very closely how COVID-19 has particularly affected minority populations and the Hispanic population in the US in particular, and for a number of reasons, some of them mysterious, some of them because of the certain work, the essential work that our Hispanic population is providing. And it is in the medical field and in many other areas, and it is, I think, hopefully people are starting to recognize also, immigrants for the value that they are providing to the fabric of our society, that is not just great food, but it is really, in the area of essential needs, and particularly in the area of medical care. So really tragic that it is also affecting our Hispanic community disproportionately, our African American community. And we're seeing, different trends around the world, but what we're also on the global level very concerned about are the vulnerable countries. We're talking about, we have vulnerable populations within the US and around the world. We have countries that are particularly vulnerable. Why? Because they already have very, let's say, think about conflict countries like Syria that has been at war for 9 years, and the hospitals have been systematically bombed, and people are internally displaced camps. We heard that there was the first cases in the biggest refugee camp in the world in Bangladesh. A nightmare because it's a very congested environment. We're seeing in slums and in India, situations in Yemen, war-torn Yemen, the first cases being reported. But then we're seeing also incredible ingenuity in some countries that is surprising us. Many countries in Africa, have been through pandemics before. They've gone through Ebola, and they're actually preparing and doing quite well. But many are saying that they're just, and I think this would resonate with many Americans, that they're not just terrified of the virus, but they're terrified of not being able to feed themselves. So we're extremely worried about well, it's already happening, a hunger crisis as a result. People not dying of the virus, but dying of hunger. And this we absolutely have to prevent. And so we at the UN, and it is, it's our 75th anniversary of the United Nations. And here we are, we were going to be, celebrating multilateralism, global cooperation. And now we're seeing that we need global cooperation more than ever before. We need cooperation, not only globally, we need cooperation in the US, you see, among states, and but across borders, within communities. We need cooperation so that we can shore up the hospitals, the communities with the equipment they need, but also with, for example, preparing for when the vaccine comes, that every person, man, woman, and child around the world, no matter what their income, gets a vaccine. That's the only way that we'll all be protected. So where does communications come in? That was your question. I think it is absolutely clear that there is a health crisis cannot be managed without good communications, without trusted communications. And the problem is that we're seeing, and maybe I can start sharing a few slides, Claudia, just one second as I get this up on my screen.
Thank you.
Yeah, just it's always better when you get to see something. So, okay. Are you able to see this now?
Yeah, absolutely. That's great.
All right. So yeah, we're putting out an initiative that I'm just going to give you a little flavor of. It's called the UN Communications Response Initiative. And basically it's around the frame, and this is too many words on this paper, but our overarching goals are really to fight the virus, but also to tackle and mitigate the devastating social and economic impact, while also, promoting a better recovery once we get through this. And even starting now, implementing the Sustainable Development Goals, which, if a lot of the Sustainable Development had been implemented before, we wouldn't be in the situation that we are now. Health systems strengthened, inequalities reduced, etc. But also climate action being, let's build back greener as well. So I'm just going to go through this a little. This pandemic we see as a communications emergency as much as it is a medical crisis. This is a very good quote from the New Yorker. And our Secretary General has now pledged, knowing that there is a scourge of misinformation that is growing across the internet, and it's really a poison that is not just, bad to see. It's really putting lives at risk. So our initiative is really, usually we're kind of, the good guys, the scientists, the institutions. We have good information, but we're not as good at packaging it and putting it out there for people to share. But the producers of misinformation are very savvy about slick production videos that beat the algorithms and seem to spread as fast as the virus and are extremely damaging. So we're going to be launching, and this is just a preview, a fighting misinformation campaign called Verified, which will be flooding the internet with science, solutions, and solidarity. I'm not going to show too much of this because we haven't launched it yet. This is just a little preview, but it is a call to action for people like you and influencers like you to help us share trusted information. We're going to be calling on people with this backdrop in mind. This was something recently from Renee DiResta from Stanford that that basically the posts that reach people on the platforms that we're on aren't those with the most reliable information. So we need to elevate the good information on social media over this bad information that's out there. This is a story that was just in the BBC yesterday that said that 25% of what is being viewed, coronavirus related videos on YouTube, are actually false. And that, our WHO and the UN and the CDC and the other government and health authorities, they are uploading videos that have good information, but they're just not that kind of populist shareable content. So this is what we want to do. And I'm putting something up from Edelman, which Claudia will recognize. Her husband's company just came out with an updated spring version of their annual trust barometer that measures what people are thinking, and in this time of coronavirus, really interesting to look at, Claudia. And I think everybody should have a look because not surprising, but I mean, one of the good things to see is that people are looking to scientists, they are looking to institutions, they are looking to governments and trusting them more. But 67% are worried that what they're seeing in their feeds is fake and false. And yet what we're seeing is people are still sharing it because they're not really sure, because there's so much information out there and it's really difficult to find reliable and trustworthy information. So Verified will be producing that daily content that is optimized across channels, and it's really based on the latest guidance from the United Nations, from WHO and other agencies on health, on hope, and around action. So it's not just going to be like kind of basic, how to wash your hands information, although in places where this is really, the virus is just starting to pick up, we might be, tailoring very basic information. But it's also going to be stories of hope, inspirational stories that are going to spread that kind of solidarity, that feeling of we're all in this together, and also the best practices and actions that we can take. So this is why I'm also using this opportunity. And when we launch next Thursday, this is again not official, but we're going to be launching next Thursday, and we're going to be asking you if you can help us by signing on to be information volunteers. We hope to recruit. We're going to be also trying to produce as much as possible in Spanish and in other languages, and to take, there'll be a place that you'll be able to sign up on our website, and we will then, once you've signed up, provide you with a daily kind of piece of content that we would be asking you to share to your circles, small, medium, big, large, it all matters. And we believe that this is a kind of volunteer work that really has meaning and really has purpose in this time of COVID-19. So I'm going to leave it there with the slides, and Claudia, come back to you, and maybe you want to ask some questions.
Yes. I want to applaud you, first of all. I mean, that this is so important, and it's so important for us as a community here. So I have a ton of questions that I would like to ask, but first of all, I do want to celebrate you, Melissa, and just, like I didn't express that at the beginning, but Melissa Fleming used to run communications and be the spokesperson of the High Commissioner for Refugees of the UN Refugee Agency. And that's how I met you, because that's where you used to run communications when I was actually leaving, after working on a number of years working on goodwill ambassadors and brand rebranding, UNHCR and social media. You're spot on when it comes to addressing the issue of fake news or lack of information. Melissa, if you don't mind, I would love to know, how do we really get involved, but also picture for you this equation that you just touched based on. 44% of Hispanics are in denial of COVID. Of 60 million people, 44% of Hispanics are in denial of COVID. And that might have a number of reasons. One of them might be because we don't get information in language. We don't get information giving it to us in the media that we see in the places where we have, or we have no choice, because only 16% of Hispanics are adequately, are equipped to work from home or study from home. And for many of us, there's no choice to stay home, so we just have to go, and there's a denial impact here. So when we started looking a little deeper, we saw that we looked at data from Nielsen and the Association of National Advertisers. 117 brands in the States have turned their communications around to talk about COVID, but only 13 of those have targeted Hispanics or have targeted language. So for us, being massive over-indexing consumers of news is super important. If we have the mortality rates we have, if we keep on running the country, to have communication that we can trust. So we have daily a directory of resources that we put together, that we aggregate from places. And now I'm thinking, we have to do due diligence. We have to actually buffer that and make sure that we verify it and understand that the information we are sharing to all of the Hispanic leaders, we're trying to be a one-stop shop for information and news on the Hispanic Star response and recovery, so that everybody knows, like, okay, I don't have to find the information floating everywhere, but we should verify it. So what you're tackling in what you just put as a program, I think is brilliant. And it is going to address the real issue of, of information for the pandemic. How do we get involved? How do we help? How do we get involved? How do we verify? How do we be part of the program? How do the leaders that are running, like the leaders that are in this program and are part of the program, run memberships of 100,000 members? Like we have the organization of the architects, of the engineers that run a number of members, and they have a responsibility to communicate. How do we engage? How do we actually be part of what you're doing?
Well, you asked some very good questions, Claudia, and we are going to definitely come back to you, because we need you. And I think, if you could help us to recruit the information volunteers, information ambassadors, those are the level of the influencers and the leaders who will, help us to be our partners in your communities. I mean, those statistics that you cited are shocking, and we need also your advice on what is the status, what are the needs. We're basing all of what we do on analysis of gaps, information gaps, and also where misinformation is most prevalent and is most damaging. So we want to fill the information gaps, and we want to strategically and counter misinformation in ways that doesn't spread information. I mean, there's some things that we're learning. Often, for example, putting out myth busting is not a good way of combating misinformation, because you're actually spreading the myth by repeating the myth. So there are definitely ways. But thank you for letting me know also that you exist, and the work that you're doing, and the community that you have pulled together, and the interest that you have in making a difference through good communication, good information.
And what are information volunteers that we can try to recruit for this? What's the job?
The job is really, you're just somebody who is interested in doing something. You don't even have to be digitally very savvy. You just need to be kind of active on social networks, or you have a WhatsApp group, you're on Facebook or you're on Instagram, and we'll give you the content. We'll say, could you just please share this once a day?
You got it.
It's really going to be very easy to be a volunteer, and maybe you get this piece of content and put your take on it. Why this is important to you, and why maybe there is some kind of relevance for you, so to make it more interesting to the people and more relatable to the people who are your friends and your followers.
So we will, we have a Hispanic Star. This is a platform pretty much like the platform of Hispanics. So all of us together under one symbol, the Hispanic Star. And we have more than 5,000 ambassadors, more than 100 organizations behind this. We will put out an ask whenever you launch to recruit information volunteers, so that we can, as the Hispanic Star association that we are, we can partner with the United Nations and with you particularly in the verified, in fighting the virus by getting proper information and proper information also in language. So count on us. I see already that a lot of people are in. Actually, if I would ask who is in, I would see the chat already floating. But we will count on us as a partner for the Hispanic community for verified, and to recruit information volunteers, where you can count on one single channel of information, so that we can get to those 10 million Hispanics that we reach.
Wonderful. Well, thank you very much for that, Claudia, and thank you to all of you already in advance for listening, for tuning in. Yeah.
Final note, any final message, Melissa? You see the world, you have a global perspective. What would you say as final words, and anywhere else that you would like to bring people to the attention, like something where you would like to guide people on?
Well, I think that this is, in the history of the United Nations, which is 75 years old, we've never been in a crisis like this one. It's bigger than because it's not simply a health crisis. It's a crisis that is hitting every kind of walk of society, and it's really having a devastating effect. It does give us a chance and an opportunity, though, to come together to, in ways that we weren't before, and to appreciate each other, to see, perhaps with a magnifying glass or lens, what was wrong with the world before, what created this, how we got here, and how we can, go forward together with a better world. And I think we shouldn't all be resigned to that. I think we're seeing, incredible, like this group that you have, solidarity among people, incredible energy coming from all walks of society, people wanting to do something, and not everybody's trying to protect their family and stay safe, but they also want to do something with their own talents, with their own networks. And I find this incredibly inspirational. So yeah, I think while we're all, shocked and concerned and worried, I think we all have reason to feel inspired.
Thank you so much, Melissa Fleming. We will try through the Hispanic Star not only to recruit information volunteers for verified for this initiative, but make sure that we show love to the United Nations in a country where, like there's a desire to support and elevate the relevance of the UN. We will try to promote the great work that, the great relevance, the great need that the UN brings to, to the world, without which we would be really in a huge gap. So count on us on both fronts, and thank you again.
Thank you, Claudia.
Thank you. Bye-bye. Bye.